Now we'll discuss ambulatory care, also known as outpatient care. So we can think of this as medical care provided on an outpatient basis, right? So somebody's not spending the night in the hospital. This could include diagnosis, observation, consultation, treatment, intervention, and rehab services. This could include really advanced medical technology and advanced procedure, even when it's done outside of a hospital setting. So it's sort of a broad category of care. um, so I'd like you to just think for a moment, jot down in your notes, what are some sites of ambulatory care, right? Where can you where can you be seen by a healthcare provider? So you might want to pause it here. So here's a list of sites. A physician's office, which we might think of as sort of a more traditional site. These days there's also urgent care. There's also a retail store clinic, for example, like a CVS that has a clinic as part of like a retail store. A surgery center, so a standalone surgery center, community health center, and also free health clinics. The difference between the last two, community health center refers to a place that's sort of federally funded, federally qualified, complies with federal regulations, so sort of more of a government type thing. And then a free health clinic tends to be entirely free and not supported by the federal government, but they are supported by other charities. So now I just want to highlight the ones that I think are particularly new, right? The last, 10, 20 years. So then there's this question about why has there been this growth both in the sheer number but also the different types, right? The variation in ambulatory care centers. And sociologists and others have identified a few different reasons. So one would be medical technology, right? Improvements in medical technology and sort of the expansion of this, that it doesn't just have to be within a hospital setting, that people can have access to this. I think another aspect is US culture, right? We want things to be convenient and quick. We want urgent care, we want the retail store clinics, right? So there's this need, but it matches with sort of US culture, US values as well. I also think there's economic aspects as well, right? People these days tend to move around more, tend to change jobs more, change locations more, so that people don't necessarily have ties to like a single doctor, to that local doctor. But if you're in a new place, you need still to be able to access healthcare. But I think the culture and the economic change often go hand in hand. Also, I believe health knowledge is another reason. This is something that's come up in other classes that we've talked about too, right? Because of the internet, because of information technology, we all have more health knowledge. We have access to this health knowledge, and so we can sort of be more self-determined, right? When you need something, you know where you need to go oftentimes, and maybe it's something that can be done in ambulatory care. Another aspect of this, and this came up both in this chapter, but also chapter 14, the healthcare system, that we know that the US healthcare system is expensive, and so maybe this is a way to save money, right? Hospitals are expensive, inpatient care is expensive. Are there more things that can be done on an outpatient basis? And that would be a way to save money. So the next thing that I would like you to think about is to think about advantages and disadvantages of patients going to urgent care versus people having a primary care doctor that they see on a regular basis, right? So what do you think are some pros? What are some cons of going to urgent care versus more people going to primary care? And you might be able to draw on some personal experiences as well. Okay. So switching gears a little bit, I want to touch upon long-term care. So if you had to guess, what percentage of older people live in some type of long-term care facility? Okay. And I know this is maybe not as exciting as if we were all together in person, But when I've taught this class before, or similar classes where these issues come up, people tend to guess pretty high numbers, right? Like 30%, 40%, 50, 70, right? Really high numbers. So let's look at the actual data. This is data from 2009, looking at all people aged 65 and over. How many live in traditional community, right? They live in their own homes, that's the green. How many people live in some sort of community housing with services, right? Maybe like a retirement community. And how many people live in actual long-term care facility, like a nursing home. And if you see, if we're just looking at people age over 65, by and large, people are not in nursing homes. People are living at home. When you split it up by age group, right, 65 to 74, 75 to 84, 85 and over, among this oldest group, there's a greater percentage that are in nursing homes or other types of community housing, but it's still way short of the guesses that people have. So I just think it's sort of interesting of the way people talk about nursing homes, what we think sort of in popular culture versus the reality of how people live. And I tried to find more updated data on this. I couldn't really find something that lays it out quite so clearly. I would imagine today I could see it going both ways. I think we have more older people, so and we have more oldest old, right, 80s and older. So we might see more people in long-term housing, long-term care. But I also think these days it's easier to stay home. There's more home care, so the numbers may be unchanged. But I'm looking for some better data on this. And living in the community is also often called aging in place. So I want us to have a chance to discuss different types of long-term care, right? So we think of long-term care as care for somebody who has a disability and needs help with daily activities. So the options are home care, right? Staying in the community and having someone come to your home. Nursing homes, which are highly regulated by the state, and oftentimes they receive federal funding, right? So there's really strict guidelines that they have to follow. And typically, though this is changing, nursing homes are more hospital-like, more of a medical-like setting, right? Assisted living is different, right? And sometimes people use these terms interchangeably and they're not the same. Assisted living is often more like hotel-like, right? Less of sort of a hospital feeling. But the other big thing is that there's a lot of variation, right? Some assisted living is a lot like a nursing home and people need a lot of help and they get a lot of help. And other times assisted living seems more like a retirement community where people are pretty healthy and they're not getting a lot of help, right? And the same thing with how it looks. Typically it looks more like a hotel than a hospital, but there's also variations within that too. The potential trouble with assisted living is that it's not regulated as much as nursing homes are, and so there's a lot of potential for abuse. But that's sort of a big topic. And then a continuing care community, I want you to watch the following video where they explain what that is as well. So if you want to pause here and look at those next two videos, or the next video on the continuing care community, or you can finish watching this one and then continue with that. Okay, along with this is making sure we understand the difference between long-term care, nursing homes, assisted living, and hospice. So go ahead and pause this now and look at the hospice video, which is also embedded on Sakai. Okay. And so I think we're not really going to get to these, questions, right? But, oh, actually, no, I will touch on these. So nursing homes are places where disabled older people who can't take care of themselves can spend time. And this can either be in the short term, right? Maybe short-term recovery from an illness or, hip replacement, or it could be long-term, right? So it's interesting. It's called long-term care, but actually sometimes it's short-term. and this can be paid for by Medicare or Medicaid. Some people even have long-term care insurance, but oftentimes people are also paying out of pocket for this in the US. A hospital is where you would go to be treated for disease, and they're very, very expensive, especially for extended stays. And then hospice is care for people who are dying, not trying to prolong their life, not trying to cure or treat them, but to give them quality of life as they're dying, as you learned about from the other video. And typically, hospice is covered by insurance, both private insurance, but also Medicare and Medicaid. And it seems that in recent years there's been a growth in hospice facilities. Part of this has to do with population aging. There's more older people, there's more deaths, but there's also this increasing interest in a death with dignity, right? Increasing interest in the philosophy that is behind hospice care. All right, so the last question to answer is, can you explain in your own words the differences between nursing homes, hospice, and hospitals? And as always, just to review our objectives for today, you can also see these on the slides. Understand how we could solve issues facing hospitals today, why there's been an increase in ambulatory care sites, discuss benefits and disadvantages of urgent care, and the differences between these different types of healthcare.